Fit for dermoscopy. Let us move on in this series of the basics, and now this episode, colors in dermoscopy. So colors in dermoscopy can be a high variation, and I show you what is the cause of this high variation of colors. This is melanin, keratin, and hemoglobin in the most cases. So melanin, where is melanin located? Either on the area of basal membrane or in the epidermis or in the dermis. So when the melanin is on the higher level to the surface, we see it much more clearer. When it's going into the deep of the skin, so for us in the upper part of the dermis, we get a kind of a little bit grayish or bluish, little bit bluish veil from the melanin based on the scattered light. So I show you examples. With examples we can learn very good. Different colors with more black and a little bit bluish. Not clear, blurry bluish. And also here blurry bluish of a blue nevus. So the melanin is located in the deeper part of the dermis. So we cannot see it clearly. And here the lentiginous nevus, in which we see the melanin in the epidermis at the basal membrane. Or here, for example, invasive melanoma, a higher variation of pigmentation. That means we see pigmentation in different layers of the skin. Also here, invasive melanoma, and very, very important. And remember, when we use polarization light, we can see the white lines, and white lines is a clue, can be a clue for any malignancy, especially for melanoma. Or here, pink colors. Pink color is always an alarm sign. When we see it in a lesion, always exclude the melanoma and then look for the specific dermoscopic features for the melanomas, in which we will come in the next step, in the next series. So keratin can also be a cause for the pigmentation, for the colors in dermoscopy. And so we can have, for example, more yellowish in early seborrheic keratosis, a little bit of brownish, a little bit blurry. Why? The epidermis is getting thicker and thicker. And here you see in older seborrheic keratosis in which the epidermis is thick. We call this also acanthosis of the epidermis, and therefore we see it more in the bluish part, because the epidermis is thicker. And remember, only in 2 millimeters deep part of the skin we can look with the dermoscope. Also very important with the actinic keratosis, that means a possible precursor of white skin cancer, of the squamous cell carcinoma, we see whitish keratin associated colors. And also here, whitish colors, and I always like to call this the white donuts. This is a very good clue for the squamous cell carcinoma, the SCC. And also sometimes we can have a kind of eczema on the nevus, based on local inflammation, based on scratching or something like this. And we also see some serocrust, which represent here the colors yellowish, little bit brown yellowish. So we know we have an eczema here. And at the end we have the hemoglobin, which can produce some colors. And also here, depending of the level in which the vessels are located, vessels are always located underneath the basal cell membrane. For example, here an angioma, a little bit close to the basal membrane. And here a deeper angioma, more located in the deep of the dermis, and with a little bit irritated intradermal or underneath the basal membrane bleeding. So we call this also sugulation yeah, based on scratching, for example, yeah. So we can also see the bleeding here of the skin based on red colors, yeah. This is also a little bit reddish, but not clear, and it's a little bit blurry. That means it's thicker, yeah, and it's not typical features of an angioma. We will talk about this later. Not typical, so something is different, yeah. So also the color are not typical for angioma. So this is basal cell carcinoma. There are tumor cell nests here in different sizes, yeah? So the colors are important in the help of dermoscopy, and especially in single flat or nodular lesions. Yeah, example, yeah, more and less bluish black, something like this. Yeah, I admit also a little bit whitish, a little bit pink alarm sign. Yeah, invasive melanoma, very small. Yeah, from the area, but 2 millimeter tumor thickness. Yeah, a reddish lesion, single reddish lesion, alarm sign, yeah, with whitish lines, alarm sign. This is invasive melanoma. Yeah, and here black, a little bit grayish, bluish, white, yeah, but more and less black. Black single lesions are typical, yeah, and we will talk about this later. So alarm sign, invasive melanoma. And here in this melanoma, I like this to demonstrate because we have black, yeah, we have blue, we have gray, we have pink and white, yeah. And when we see more and more colors, we have an alarm sign, and especially with pink and white, yeah, and we know something goes wrong, invasive melanoma. But we can also have these typical colors in, for example, early basal cell carcinoma, nodular, yeah, and look to this grayish, blue grayish color, yeah, or completely red, yeah, with this typical ever rising vessels of the basal cell carcinoma, yeah. Also here, nodular, red, and typical vessels, yeah. And then we come deeper and deeper into the area of dermoscopy. So here, the colors are helpful for us in the management decision. Yeah? And this will be, after this basic colors in dermoscopy, this will be the next step, which is coming up soon for you. Yeah. So the management decision of malignant and benign lesions. And this is very important. And therefore, we need these basics of the physics and the colors. So I'm happy to see you there, and keep going and to be fit in dermoscopy. Thank you.